my name is Brooke Kinsey, student physical therapist, and today we're going to be looking at a transfer using a sliding board to get our patient from their wheelchair to their bed and returning. This transfer is going to be used for patients who cannot do a standing transfer and those who may not be safe enough to do the transfer on their own. We're going to, in particular, be looking at patients who may have the following precautions: a total hip arthroplasty, a sternal precaution, a spinal fusion, or hemiplegia or paresis. Make sure to refer to video 23 prior to viewing. When doing the transfer with a patient who has recently had a total hip arthroplasty, make sure that the patient does not obtain 90 degrees or more of hip flexion. Also make sure that the patient does not adduct the lower extremity that has been affected past midline and refrain from internally or externally rotating the thigh. Okay, Abby, I'm going to hold on to the gait belt. What I'm going to have you do is push up and move your hips this direction. Make sure to keep this leg straight, okay? Ready? 1, 2, 3. Very good. And adjust. Very nice. And one more time. Very good. When doing this transfer with a patient who has recently had a spinal fusion, make sure that they do not rotate the trunk at a level above or below the spinal fusion. I'm going to have you push up with your arms and shift your hips over towards the bed. Make sure not to twist at all at your trunk, okay? Try to keep it as straight as you can. Okay, I'm going to come in here on the count of 3. Ready? 1, 2, 3. Very good. Readjust. Good. One more time. Very good. When completing the transfer with a patient who has a sternal precaution, the patient will not be able to perform the push-up part of the transfer. Instead, have the patient cross their arms over their chest, gently hugging a pillow. You'll have them shift their shoulders and their head anteriorly over their thighs and their knees. Because the patient cannot do the push-up portion of the transfer, this transfer must be completed as a dependent transfer. In addition, sternal precaution patients cannot be guided using a gait belt. So in this case, we will need to unweight the buttocks to perform the transfer by guiding the patient and unweighting the buttocks by lifting up on the butt and the hips. Lastly, because sternal precaution patients have typically had a surgery that utilizes their saphenous vein, this has been removed and the patient should wear a saphenous vein harness. This harness will keep the leg, specifically the knee, in extension so that it reduces the amount of weight that the patient is bearing on the affected limb. In the case of a saphenous vein harness, the patient would be wearing the saphenous vein harness. In this case, we do not have one for the video. So Abby, I'm going to have you go ahead and hold the pillow over your chest and cross your arms, okay? Perfect. I'm going to have you lean into me like this, and I'm going to lift at your hips. Help me push up with your legs, okay? Ready? 1, 2, 3. Very good. One more time. 1, 2, 3. Completing the transfer with a patient who has hemiplegia or paresis, have them move towards the weaker side because they will be able to use their stronger arm and leg for propulsion to move them towards the wheelchair or to the bed. You can also have them move towards their stronger side, as if the sliding board has a hand cutout, they can pull themselves towards the direction they need to go. With hemiplegia, going towards the patient's weak side. So Abby, I'm going to have you put your hand on the armrest and also support your other arm here, your other hand here. And I'm going to have you push away. Try to lift up as much as you can, okay? Ready? Go ahead and push. Good. And resituate. And push again. Very good. The patient with hemiplegia moving towards their strong side. So Abby, I'm going to have you reach across the arm of the chair, if you can reach it. Very good. And I'm going to have you pull yourself, trying to push up with your legs to take the weight off your buttocks, okay? All right, ready? 1, 2, 3. As a final note, make sure you're guarding the patient the entire time, whether it's an assisted or a dependent transfer. You can stabilize at the shoulders as well as at the trunk using the gait belt or at the hips. Also make sure that the patient does not grip the sliding board so that their fingers wrap around the edges, as this is a pinching hazard.